So now we have next presentation by Dr. Sharon DSOUZA, and she is the AIOS Cornea Award winner, talking on integrating Ipsc derived corneal endothelium on ex vivo model.
Good morning, everyone.
Yeah.
So we know that the treatment for most of the corneal endothelial problems is an endothelial keratoplasty. However, there is a global shortage of corneal tissue, and there are problems related to corneal grafts like rejection or failure. So what are our options to treat if we want to bypass these issues? One being the generation and transplantation of corneal endothelial cells. Now, as complicated as that sounds, there have been groups around the world who have worked on it for the last 15 to 20 years, and there's a development of many new therapeutic modalities for trying to build this. But the challenge is that most of them have tried to expand the corneal endothelial cells from existing corneal endothelial tissue itself. So the timer is not started. From existing corneal endothelial cells itself.
Timer is not working.
And there are problems when we try to expand corneal endothelial cells. It may go to endothelium, or it can go into fibroblastic proliferation, which has issues with the cells after that. So our plan of work was to try and generate the endothelial cells from induced pluripotent stem cells, which are actually derived from peripheral blood. So we take a normal peripheral blood sample and then try to derive endothelial cells from that. We would then need to integrate it into some sort of a substrate or inject it into the eye, as has been shown by various groups before, maintain the morphology and function, and then move on to animal experiments and in human clinical trials. So as I was saying, a normal peripheral blood sample was taken, and these mononuclear cells were reprogrammed to form pluripotent stem cells, which, as the name suggests, are cells which can go into any sort of cell type. And then we moved to make these into a corneal endothelial cells using a human Sendai virus. So we all remember the corneal endothelium type of having the endothelial hexagonal morphology. And in the last slide, you can see that the cells are now trying to approximate that hexagonal shape. It's not enough that they look like endothelial cells. They also need to, function as endothelial cells. And the two most common markers that we see or check for to say that these are endothelial cells are the ZO1, which is the zonular occludence, which is the barrier between the two endothelial cells, and the sodium-potassium ATPase pump, which helps the ions function. So we wanted to integrate these cells, which we now have, into a sort of a substrate. So this was our methodology, where we took a cadaveric eye, we did a atraumatic denudation of the endothelium, and then injected cells into it to try and see if we could integrate it into an actual cornea. So you see these images where before the endothelial cell removal, you can see the cells on the endothelial button. After the endothelial cell removal, there's no cell morphology visible. And once we've injected the cells, again, the cell morphology is starting to show after a culture of 7 days. We again looked at the markers themselves, and both ZO1 and sodium-potassium ATPase were reflected on immunofluorescence staining of the corneal endothelium. So we move on to see now, is this the only way to try and integrate these cells, or is there anything more? Can we use anything else as a scaffold? And around the world, there have been work on amniotic membrane and collagen markers. But what we thought is to try and get an alternate approach, and we were looking at using the normal lenticules which we take from the SMILE procedure, culturing the endothelial cells onto this, and then using this as a scaffold to move forward. And it was very reassuring to see that it is actually possible to grow the endothelial cells on these lenticules. And when we looked at the markers again, we can see the hexagonal morphology starting to form with the ZO1 and sodium-potassium ATPase, which are our two functional markers. So going forward, we are now moving to animal experiments, where we are taking these cells which we have grown onto a lenticule or as a cell injection. We're going to be putting them into the New Zealand white rabbit, and then looking for the same morphological markers and integrative markers that we are. So in conclusion, we must move on to find alternative sources. There have been groups around the world working on it. We are one of the first to try and do it using peripheral blood, which is available to us in plenty. And we've now reached a stage where we can integrate and maintain the functionality. And hopefully with the animal experiments, we should know more. Thank you very much for a patient listening.
That's a very nice, I think, development which has occurred. So now you have carried out that stage of animal experiments
Yes,
also in New Zealand rabbits?
We have injected it into the New Zealand rabbits. We will be following them up for 6 months now to see how long the cells survive.
Okay.
And then we will be checking the tissue for.
Right.
Thank you so much.
Thank you.